Imagine trying to cross a raging river. The water's beating against you, self-doubt plaguing your every step, uncertain if you're going to be swept away at any moment. This is what it feels like to be recovering from an addiction. Now imagine trying to make the journey with your pockets filled with heavy rocks, every step weighed down, and the feeling that the journey is impossible. This is what it feels like when you are suffering from a substance use disorder and a co-occurring disorder at the same time. Having co-occurring disorders presents many challenges to an individual in recovery. Unfortunately, even today, there remains a split between mental health professionals and addiction professionals. A co-occurring therapist are stuck somewhere in between. Sadly, so is an individual suffering from co-occurring disorders. A Better Today is a licensed co-occurring facility. We heal the whole person, not just their addiction. We care about a person's quality of life from the moment they walk through the door. Another problem with the co-occurring disorder is the stigma attached to mental illness. Although addiction as a treatable disorder has come a long ways, many people still think of a mental health disorder in a negative light. This may cause an individual with a co-occurring mental health disorder to resist their diagnosis. We know that an individual with a co-occurring disorder is more likely to relapse than somebody who is only suffering from a substance abuse disorder. It is therefore essential that someone with a co-occurring disorder receive treatment for both substance abuse disorder and the mental health disorder. This maximizes the individual's chance for a successful recovery. Co-occurring disorders are far more common than most people realize. 65% of addicts have a co-occurring disorder. 22% of mental health cases also have an addiction problem. Up to 50% of alcoholics suffer from major depressive disorder. Many professionals believe that this is partially responsible for the high relapse rate among addicts and alcoholics. Many mental health disorders are the result of deficiencies in both serotonin and dopamine in the brain. Serotonin is responsible for a feeling of well-being and mood regulation. Dopamine is responsible for pleasure. Addictive substances such as alcohol, heroin, and cocaine produce one or both of these brain chemicals. It is common for someone with a mental health disorder to self-medicate using addictive substances. These drugs lessen the effects of the mental health disorder. Many addictive substances can lead to mental health conditions. Sometimes these conditions are temporary. Sometimes they are permanent. The most common co-occurring mental health disorders are mood disorders, anxiety disorders, and psychotic disorders. Mood disorders include major depressive disorder, persistent depressive disorder, seasonal affective disorder, and bipolar disorders. Mood disorders are caused by a deficiency of serotonin in the brain. Ironically, alcohol, opiates, marijuana, and benzodiazepines all cause the brain to make more serotonin. When someone with a mood disorder uses one of these drugs, they start to feel normal again. Is it any wonder these drugs are so difficult to give up for someone suffering from a mood disorder? Anxiety disorders include post-traumatic stress disorder, obsessive-compulsive disorder, and generalized anxiety disorder. Anxiety disorders are caused by a deficiency of dopamine in the brain. Someone with an anxiety disorder feels an impending sense of urgency or a fear that something bad is about to happen. When someone with an anxiety disorder uses one of these drugs, they start to feel relief and power. Psychotic disorders include schizophrenia and schizoaffective disorder. These disorders are caused by excessive dopamine in the brain. Since most drugs produce dopamine because they give us pleasure, an excessive amount of a dopamine-producing drug can cause hallucinations and delusions. A hallucination is seeing or hearing something that isn't there, and a delusion is believing something that isn't real. The more dopamine the drug produces, the more likelihood that an individual will have hallucinations or delusions. The largest dopamine-producing drug is methamphetamines, and long-term use of methamphetamines can produce a condition called meth psychosis. What came first, the mental health disorder or the addiction? In the case of co-occurring disorders, either can be true. Sometimes the mental health condition comes first and the addiction follows. Sometimes an addiction turns into a mental health problem. And sometimes an addiction just looks like a mental health condition. The first thing a co-occurring therapist must do is determine whether or not the symptoms are drug-induced. Several drugs, such as alcohol, cocaine, methamphetamines, THC, and LSD, can cause depression, anxiety, and symptoms of psychosis. The only way to determine if these symptoms are drug-induced is for the individual to remain clean long enough to see if the symptoms go away. If the symptoms persist, then the individual most likely has a co-occurring disorder. Treatment is typically individualized and addresses the individual's reasons for using. In the event of someone with co-occurring disorders, often the mental health disorder convinces the individual that he or she needs drugs to combat the symptoms of the mental health disorder. Only by treating both disorders at the same time can the person have a fair chance at recovery. When those concerns include depression, thoughts of suicide, or anxiety, the person's treatment plan must also reflect how these issues will be treated. When an individual with co-occurring disorder leaves treatment, that person's road to recovery doesn't end. You could say that someone with co-occurring disorders will always have co-occurring disorders, even if one or the other is in remission. The individual should also seek professional help from a psychologist, a psychiatrist, or a mental health therapist. This professional should have experience working with co-occurring disorders, so don't be afraid to ask about this person's experience. A psychiatrist can prescribe medication, whereas a psychologist cannot. A psychologist is more concerned with psychotherapy. A mental health therapist can do neither. However, they can offer counseling for emotional and daily problems. Supporting someone with a co-occurring disorder means being aware of both problems and how they relate to each other. Encouragement, rather than judging, is a recipe for their continued success.